Hello everyone, I'm Dr. Ismail Najad, and in this video we want to talk about the CT scans. We want to know how we can evaluate the CT scans for a rhinoplasty patient. Of course, you know how to evaluate the CT scans. I mean, you know the structures. Where are the turbinates, where are the nasal bone, where are the septum, but actually we want to talk about the applied anatomy. It means that we want to evaluate the structures and the anatomy of the nose. We want to know how to follow the structures. What should we actually seek for? What should we assess completely? And then we can actually evaluate the CT scans. So let's see how should we start. The first thing we should start and to evaluate is the nasal bone, of course. It's not just to locate the nasal and assess the nasal bones. It means that you should seek for the previous fractures, okay? Because that makes the surgery too hard. So on the CT scans, first I scroll and look at the nasal bones on the both sides, right and left, and to see if there is any abnormality or any problem there, any previous fracture. So that is the first step. After that, we want to assess the nasal septum. For the septum, we should actually try to see the deviations of the septum. It means that we should try to see if it is C shape, if it is S shape, or if there is any perforation on the septum of the nose. So it is really important to evaluate these things. So again, I scroll a little bit to see the septum of the nose, the bony part, and also the cartilage one. I don't see any perforation. And after that, I see a little bit deviation. It's a C shape or C type deviation of the nose. So it shows that maybe there was a previous trauma there, or it is actually a congenital abnormality. So after that, we want to see the problem on the turbinates, okay? For the inferior turbinates, we seek for the Concha hypertrophy because that obstructs the nose passage and the pathway of the nose, and in that case, it is very hard to breathe for the patient. So we try to reduce and reduce the inferior concha or turbinate. I see there is a hypertrophy of the inferior concha, and that is a problem because there is an obstruction of the right passage of the nose. So we should solve that for this patient. After that, for the inferior turbinate, we seek for the synechia. It means the adhesion of the nasal septum and to the inferior turbinate. I see the synechia there. So that is another sign why my patient can't breathe very well and he has problems, especially during sleep. Sleep apnea sometimes happens because of the nose obstruction. So after that, we try to evaluate the middle turbinate. For the middle turbinate, again, we seek for the hypertrophy, but more important, we seek for the concha bullosa. It means that the air cells and air cavity inside the middle turbinate. In this patient, okay, I don't see any bullosa there. But the middle turbinate here, again, there is an adhesion to the septum of the nose. And after that, we see and we try to evaluate the sinuses, okay? The maxillary sinuses, I see the chronic inflammation of the Schneiderian membrane there. It shows that the mild sinusitis is there for the patient. So we should be very careful for that and try to evaluate the patient. Maybe the patient has received some kind of antibiotics before that, or another surgery maybe is necessary there before the nose surgery. and I check for the ethmoid cells. Also, I check for the sphenoid sinuses. It is clear there, so there is no problem. And that is the most important problem in this case about the sinusitis of the maxillary sinuses. So that is actually the applied anatomy. It means that you should be very careful. You should know what do you want to see on the CT scans. And after that, that is easy to evaluate and to assess your patient. Without knowing what are you seeking for, actually you are wasting your time. Just to check that is the palate, that is the septal deviation, or I see the turbinates. That is not enough. You should know, and you should actually complete the problem list of the patient. After that, you can have a very good surgery, and you are gonna be very successful on that case. Thank you for your attention. And on the next video, we want to talk about reading and evaluating CT scans for the trauma cases.